Our next speaker is Foad Taghdiri, a student in my lab who's going to talk about self-paced saccadic eye movements and white matter integrity in patients with post-concussion syndrome.
Thank you. It's really my great pleasure to present part of our work here in the symposium. We looked at self-paced saccadic eye movements and white matter integrity in patients with post-concussion syndrome. 80% of all traumatic brain injuries are mild TBI or concussion, and concussion is associated with a range of symptoms, but fortunately most of the symptoms recover within days to weeks. However, 10 to 15% of patients never experience resolution and may suffer these symptoms for months, years, or even indefinitely. Persistence of symptoms for an extended period of time is referred to as a post-concussion syndrome or PCS. This slide shows some of the most common symptoms which are associated with PCS. These symptoms can be somatic symptoms, affective symptoms, or cognitive symptoms. Despite this, the lack of a diagnostic biomarker limits the reliability of making a correct diagnosis. So, an objective and quantifiable methods are essential for accurate diagnosis and predicting prognosis. We also know that neural injuries in patients with PCS are usually beyond the detection threshold of conventional neuroimaging techniques such as MRI or CT scan. In recent years, several neuroimaging and neuropsychological techniques have been proposed to help clinicians and researchers to diagnose this condition. Another assessment which has shown some promise in recent years is oculomotor function testing. And the idea behind this is that the knowledge that the eye movements are controlled by a highly complex network throughout the brain, and the perfect visual system actually needs intact efferent and afferent neural pathways. Another advantage for this assessment is many oculomotor functions are independent of subjects' intellectual abilities, such as IQ or their neuropsychological impairment after concussion. There are different types of eye movements. Saccades, smooth pursuit eye movements, and vergence movements are the three basic types. The idea is the more rostral part of the brain are involved in controlling voluntarily eye movements such as inhibition of reflexive saccades or anti-saccades, or controlling intentional saccades, whereas more caudal parts of the brain are involved in triggering involuntarily and reflexive eye movements. Saccades are defined as rapid movements of the eyes between two fixation points. And we have different assessments to evaluate this type of eye movement. In anti-saccade, there's the central target on the screen, and a stimulus will appear on the screen right or left to this target. And we asked our patients to ignore this stimulus and instead fixating on the opposite direction. Another assessment is self-paced saccades. In this task, there are two different targets on the screen, and we ask our patients to move between these two targets as fast as they can. These two assessments are voluntary eye movements. On the other hand, reflexive saccades are unintentional movements of the eye and performing the saccades from this central target to appearing stimulus. Here we come to the technique that we used for our project, visual attention scanning technology, or VAST, which is developed by Elmore Company in Toronto. In our eye movement assessment battery, we had a self-paced SACAD task. As I mentioned earlier, we had 2 targets, 20 degrees apart from each other, and we asked our patients to move between these 2 targets as fast as they can for 40 seconds. And we calculated the number of self-paced SACADs for this period of time. We had 65 PCS patients, 24 female and 41 male subjects. The mean age of these patients was 34.5 years old. All of our patients experienced multiple concussions, and the average time between last concussion and the time of MRI acquisition was 25.47 months. And as I mentioned, all of our patients were post-concussion syndrome, so all of them were symptomatic, and the minimum number of symptoms was 4, and the maximum number of symptoms was 51. In terms of mechanism of injuries, we had 26 patients who experienced concussion only during sports. We had 3 patients who got concussed in motor vehicle accidents, and we also had 36 patients who had a mixed mechanism of injuries. But even for patients in this group, the main and the most common mechanism of injury was sport. Using a questionnaire, we asked our patients about their symptoms after concussion in 9 domains: symptoms and difficulty in memory, executive function, language, visuospatial, motor, sensory, behavioral symptoms, constitutional symptoms such as fatigue, dizziness, and pain in body, and headache and neck pain. In terms of white matter integrity, we used a seed-based probabilistic tractography and looked to 4 major tracts: right and left, superior longitudinal fasciculi or SLF, cingulum fasciculi, uncinate fasciculi, and corpus callosum. We picked these 4 tracts because it's believed that they are involved in visual perception and cognitive processes. This slide shows some of the inclusion seeds that I used in FSL software to do the probabilistic tractography. As you probably all know, we can measure axial, radial, and mean diffusivity throughout our tracks based on the water molecule diffusion. We also calculated and measured the fractional anisotropy, or FA, which is a scalar value between 0 and 1, and 1 means the most anisotropic, and it's believed that white matter tracks that are working more efficiently should have also higher FA values. As I mentioned, we had 65 PCS patients, and we categorized our patients based on the median number of self-paced SACADs into 2 different groups. We had LS group, which contain patients who performed lower number of SACADs, and also HS group, which patients in this group had higher number of self-paced SACADs compared to the previous group. We saw that there is a significant difference between our patients in LS group and HS group. And also there was a significant negative correlation between total number of symptoms and number of self-paced SACADs. When we saw that there is a significant correlation between the total number of symptoms and our eye measure, we were interested to see which symptoms are deriving this significant correlation. We also saw that our patients who performed lower number of saccades had significantly higher number of executive, behavioral, and constitutional symptoms. In terms of white matter integrity, our patients who were in LS group and also had a higher number of symptoms also showed significantly lower FA values in left uncinate fasciculus. These patients also showed higher MD and RD values in this tract. We saw exact same pattern in a left cingulum fasciculus. So our patients in LS group again had lower FA values and higher MD and RD values in a left cingulum. Many believe that cingulum tract is composed of many short fibers, and it's likely that different parts of the cingulum are principally composed of distinct white matter group of fibers that are likely to reflect different underlying functions. So based on this publication by Jones and colleagues, we partitioned the cingulum tract into three subcomponents. The blue one, which is the subgenual part, the yellow one, the body or retrosplenial subcomponent, and finally the red one, which is the parahippocampal subcomponent of cingulum. After correcting for multiple comparisons, the only one which remained significant was the correlation between left subgenial part of cingulum and number of self-phase saccades. It's believed that this part of the cingulum, which is the anterior part, is the one which is linked to apathy and depression. And finally, we saw a positive correlation between the total number of self-phase saccades and the time passed from last concussions. I use the log of this variable because time from last concussion, as you saw in my one of the first slides, this variable was not normally distributed, and I use the log of this. In summary, we saw that decreased number of self-phase saccadic eye movements reflects higher symptom burden, particularly symptoms associated with executive functions. Also, we saw that this eye measure reflects integrity of some of the white matter tracts involved in visual perception and the neurocognitive processes. And finally, we saw that self-paced saccades are associated with a time period of being concussion-free. Taking all these into account, we might consider self-paced saccade as a potential biomarker of recovery. However, we believe that more studies, particularly longitudinal studies, are needed to prove this theory. Finally, we would like to thank all the participants that contributed their time and experience to make this project happen, and thank you all for listening.
I guess we have time for one question, so we're running a little behind.
Sure. Do you think there's something about using the self-paced saccades as a test that's better than just using the reactive or reflexive?
Because, as I mentioned in one of my slides, it's believed that Self-phase saccades, because they are intentional saccades, are controlled by more higher parts of the brain, more anterior parts, such as frontal eye fields or parietal eye fields, supplementary eye fields. On the other hand, reflexive saccades are controlled by brainstem and posterior parts, so we thought that maybe this test can be used because it's related to more cognition control of brain.
Thank you.
Thank you.